Good evening, everybody. This is Dr. Josh Goodwin here at Regenexx Las Vegas. This seminar is going to be more of an educational time for us to spend a little time talking about different treatment options for spinal conditions and different orthopedic problems with our cervical, thoracic, and lumbar spine. As you can see on the screen, we're talking about regenerative interventional orthopedics, which we'll talk more about. The overall format of the webinar is going to be just some introductions, talking about traditional treatment options, going into how we make decisions and some of the options that we provide here at the Regenexx Clinic. Some may be familiar with them, some maybe not. That's why we do these, just to educate people so people can be aware of alternative options outside what you typically hear out there, such as medications or steroid injections or surgery. So we're going to go into that. At the end of the webinar, there will be some time for question and answer. As I mentioned, there's a chat box and a question and answer box that you guys can chat or write down some questions. I probably won't stop and answer them as they come up, but we'll have time at the end, and there'll be our contact information if people need more, contact us to get us information, or if they want to schedule consultation. So my background, I'm a medical doctor. I'm board certified in physical medicine and rehabilitation. That's a non-surgical specialty, but we deal a lot with orthopedic conditions and trying to treat people pre or post-surgery, help improve function and pain. I am fellowship trained in sports medicine and interventional spine medicine, so a lot of injection-based treatments for the spine. In my fellowship, I did do a little research utilizing bone marrow-derived stem cells for low back pain and disc degeneration, and I am a co-author on a review article for treatment of low back pain utilizing stem cell treatments. I've been with Regenexx since 2015, so I've been with them for almost 10 years. We'll learn that Regenexx has been around for 20 years, and we'll kind of talk more about what we are and what we do. But that's a little bit about my background. I've been at the Las Vegas clinic since 2018, so I've been here since then. But again, I've been with the Regenexx organization for 10 years almost. So as I mentioned, this whole webinar will be more focused on spine. We do have some that are just a general overview of what we do, and we'll do some more specific ones on other joints, such as knees and shoulders and those kind of things. So back pain. So it's a major cause of disability, and it's very expensive. So most of us probably know someone that's had back pain, neck issues, at least one point in our life, or at least somebody that we know. So, and as you can see, it can cost and have a huge economic impact, both with direct treatment and indirect costs, such as lost time of work and those kind of things. So it affects a lot of people, and it costs a lot of money to treat. And so you can see the average or the mean cost of spinal surgical intervention, such as fusion or discectomy, and how much a cost can be for those types of procedures. And these are old numbers, but we can see how many are performed. 700,000, 600,000 of these. This is kind of old data, so it's more today. So it affects a lot of people, it costs a lot of money, it creates a lot of dysfunction and impairment in quality of life. Now, in order to understand why we can get back pain, we have to understand the anatomy and what are the potential pain generators. And we'll get into our approach and how we look at the spine and how we think that things work together. But looking at the individual components, we have our bony elements, our vertebrae, and these extend from our neck all the way through our low back. In between the vertebrae are our shock absorbers, our discs, This is specifically looking at a cervical disc in your neck or a cross-sectional view of a disc in our spine, showing the two components. Behind that being your spinal canal, where your spinal cord, your nerve roots are. And then behind that is where we have our facet joints. These are the joints of the spine that allow motion. Now, what people don't always think about is the spine stabilizers. And we have muscles throughout the spine that are important stabilizers of our spine. And when these go offline or degenerate or atrophy or become affected by surgery or other intervention, they can be associated with progressive degeneration or chronic back pain. We also have cables, which are called ligaments, that support each individual segment. And these are also important for preservation of our tissue, and things like injuries and whiplash and trauma can affect the ligaments, which create instability and future degeneration. So these are important structures to consider. Now, knowing that there are different structures in our back, bone, disc, joints, nerve, muscle, ligaments, these can all be sources of pain. And so, for example, we can have bone fractures, we can have herniations and tears of our discs, we can have joint arthritis and degeneration, we can have nerve compression, inflammation, tumors, chemical irritation. We can strain or sprain our muscles and ligaments, trauma or just degenerative process. And so these are all potential sources of pain. Now, currently, there's a host of different things we can do to help with pain, and we need to understand all of these. Obviously, we like to highlight that lifestyle modifications can be done by everybody. So if we're not exercising, if our muscles and support tissues are not strong, we can lose weight if we're overweight. These are all things everybody can do. Most people are familiar with different medications that we can take to help improve pain. We'll get into some of the downsides to different medication therapy. All in all, when we're thinking about different options for any type of condition, it's all a balance of risks and benefits. What's the potential benefit? What's the potential risk? And do one of these things outweigh the other? And then we can compare that across the different treatment options. Physical therapy and chiropractic care, not a huge downside to doing these, can be very helpful. There's massage and acupuncture. There's different injection-based therapies. And then these are just the more traditional things. And there's different types of surgery, like cutting out tissue, fusing tissue, or replacing tissue in the spine. Now, if we look at something simple like just taking an over-the-counter anti-inflammatory, which can be helpful, and a lot of us do use this, even something as simple as that carries some level of risk, right? These non-steroidal anti-inflammatories are associated with increased cardiovascular risk, stroke, heart attacks, increased blood pressure, kidney dysfunction, stomach ulcers, and death. So we have to think about that. There's also more studies coming out that chronic use of non-steroidal anti-inflammatories can actually increase arthritic pain over time, can disrupt healing, those kind of things. So not without risk. We have to balance these things. Obviously, strong pain medications, opiates, your hydrocodone, Percocet, morphine can be helpful at reducing pain, but also carries significant risk with dependency, tolerance, abuse, constipation, cognitive side effects. And so we have to be aware of those things. Physical therapy can be helpful. Most people can benefit from some level of physical therapy, because even high-level athletes that are very well conditioned and trained can still benefit when they injure themselves from physical therapy. Bracing can sometimes be helpful temporarily. Now getting into the spine injections, a lot of us hear about these cortisone-based injections, these corticosteroid injections. These are strong anti-inflammatories and can help improve pain and inflammation, but they can be associated with different risks and complications. So what can those be? increasing blood sugar, weight gain, flushing, anxiety. They are focally toxic to cartilage, and they can increase the risk of osteoporotic fractures in postmenopausal women. So while they can be helpful, they can come at a cost. And so it's a balance of all of these different things. So for example, different traditional spinal injection-based therapies are epidural steroid injections. These are commonly done throughout the United States and around the world. They tend to use high-dose milligram corticosteroids, which we know can be locally toxic. And even just one epidural can increase the risk of compression and spinal fractures by almost 30% in postmenopausal women, not to mention their local toxic effect on the tissue. So while they can be helpful, they can come at a cost. Other injections, you can inject steroids into the facets. So again, understanding the different structures of the spine that can cause pain. Steroid injections are focally toxic to cartilage, which when you have joint arthritis, you're having some wear and tear of the cartilage tissue. And when you combine that with, say, long-acting anesthetics, this is synergistic and amplifies the toxic effect on the tissue and can enhance and actually accelerate arthritis as opposed to help it. There are things called radiofrequency ablation, which is a specific spine pain procedure where you're essentially killing the nerves that innervate your facet joints, which I used to perform these. It can be helpful with reducing pain. They are a destructive type of procedure, and luckily it's just a minimally invasive procedure, but some of the branches of this nerve do innervate your deep back muscles, which we'll talk more about, and that may lead to a little bit of temporary instability at those levels and potential muscle atrophy. So again, just balancing risks and benefits. And of course, spinal surgery, not the most successful surgery out there. Sometimes it's the best option, but all the different complications to include failed back syndrome, repeat herniations, chronic back pain, additional surgery, infection, hardware breaking, nerve injuries, paralysis, death, anesthesia risks. All of those things are things that need to be considered. Surgeries tend to be more invasive, hence more potential risk for complications. So what we have to do is try to balance that with alternative treatment options, and that's where we come in, where our goal is tissue preservation. So we're going to talk about that and trying to restore, enhance, and preserve our own tissue without trying to replace, fuse, or extract that tissue when we're able to. Now, not everybody's a candidate, so we'll talk more about that. So our treatments are less invasive because they're all injection needle-based procedures with a specific goal to help preserve, stabilize, and improve our own natural orthopedic tissue using just natural healing mechanisms that we know already within our bodies. So just a little more history about Regenexx. Regenexx is a large network of physicians, started in 2005. We've been around for almost 20 years. We have a big medical research facility, research and development team that kind of started. We perform clinical research, randomized controlled trials, laboratory-based research. We also have a large patient registry of about 90,000 patients where we track our patient outcomes over time, and we use that to help guide our decisions. And then we publish that information for people to have access to. We have about 85 clinics around the United States and more international clinics. Within our registry over the years, we've treated more than at least 200,000 patients, could be even more than that. We're currently tracking about 90,000 patients in our registry, and roughly 18,000 of that 90,000 are low back or neck issues, so spinal conditions. So that's important because it's important to understand our protocols, our process. So if you went to your typical physician that performs similar procedures or orthopedic surgeons, not many people track their outcomes to truly understand how much it's helping, how much it's not helping, what are the risks to the people, are we actually doing and preventing the progression to surgery, those kind of things. And so luckily we have information to help guide our recommendations and education of patients. And all of this is just the advancement of medicine. We've seen that in many different fields over time. In cardiology, going from open heart surgeries to like angiograms and surgeries just through the veins where you're sending catheters and things like that. Orthopedic surgery going from open meniscal resections to arthroscopic procedures. And this is just evolving more as we learn more about ways to address orthopedic tissues through needle-based procedures, using things such as stem cells, platelets, growth factors, extracellular matrices. And these are just delivered via minimally invasive injection-based procedures. And because it's less invasive, it's going to have less downtime, less risk than more invasive surgery. So all things to consider when, assessing the different options for your orthopedic problem, specifically your spinal issues. Now, we do treat all joints, but obviously this one's specifically about spinal conditions. Now, we're going to talk more about our approach. We like to look at the person as a whole unit, specifically the spine. There's all those different individual components, but they work together as functional units. And so we have to understand how they work together and then how they affect other parts of our bodies. People can have something going on in their back, but their pain is in their ankle or their butt or their hip or their knee or their thigh or their elbow, because we have referral patterns, we have nerves that send pain to different areas. And so if we don't recognize those things, then we're not going to be looking into the right area. And we see these patients all the time that come from different clinics, orthopedic clinics, or because they have less time with patients, they don't maybe perform a full physical exam to understand that the hip pain is actually a pinched nerve. And they're getting set up for surgery for a condition that likely won't respond because it's not the pain generator. So it's important to have a full assessment. And as I mentioned, we approach things not as individual components, but your spine as a full functional unit. And that's kind of how we approach our treatment when dealing with spinal patients and any orthopedic condition in general. For example, when you get disc degeneration and your disc collapses, these ligaments are forced closer together, which creates an instability across this segment. When your disc collapses, you also overload the facet joints and they get increased strain. And so when we're treating things like disc degeneration, we like to approach these things in the totality and kind of the full functional approach, including muscles and the support structures. So it's just an approach that we have with trying to treat more comprehensively. And so what are the different options out there besides your traditional cortisone, ablation, anti-inflammatories, pain medication, steroid medications, and surgery infusions? So as I mentioned, everything we do is injection-based. Now, there are different solutions we inject, which we need to talk about. There's something called PRP. There's a host of growth factors we can extract from platelets called platelet lysate. There's something called platelet-poor plasma that comes from your blood that is left over after we process these cells. And there's something called bone marrow concentrate, which contains mesenchymal stem cells that we can use for orthopedic and spinal conditions to help improve, repair, reduce inflammation, strengthen those different components of the spine. Now, we all know that we have the capacity to heal. We've all cut ourselves, we've known somebody that's broken a bone, or even had surgery, and you have to heal. You have an incision, you have tissue that's cut and disrupted in some way. And so our body has mechanisms to heal tissue. We have cells within our blood called platelets. We have proteins and anti-inflammatory proteins we can use. We have cells within our adipose and our bone marrow tissue called mesenchymal stem cells that are involved with maintaining our orthopedic tissue that we can take advantage of. And these are the things that we focus on utilizing in trying to improve and preserve our tissues, obviously with the goal of preventing surgery. So as I mentioned, one of the things we use are called platelets, and these are the cells in your blood, and they have many different functions, including clotting, but also they are major activators of healing. And they contain these different growth factors that help stimulate different components of cellular repair. So we have growth factors that help with cell growth, new blood vessel generation, collagen formation, wound healing, growth of new tissues. And so we could take advantage of the natural properties of platelets and utilize those properties in tissues that are having overload, wear and tear, or injury, and now creating pain and dysfunction. And so we tend to utilize these cells for more mild to moderate arthritis of the spine, ligament sprains or strains, muscle injuries, disc issues, small tears in discs, around irritated nerves. And so these are the cells that we use in place of steroids, and with the goal of helping try to improve that tissue so people don't have to progress on to a surgical intervention. We can also extract those specific growth factors that are found inside platelets, and this is called platelet lysate. We tend to utilize this around those inflamed nerves. So people that say, oh, I have sciatica or a pinched nerve, these are the growth factors that we can inject around the nerves because they're more anti-inflammatory. Now, this cannot be derived from just a simple bedside centrifuge that a lot of clinics have. We have a full cell processing laboratory that allows us to customize different types of products from platelets, from bone marrow, proteins, growth factors, these kind of things. And so there's a little more flexibility with having a more full flexible lab platform as opposed to an automated machine that's kind of more of a one-size-fits-all approach. But platelet lysate's been used around nerves like carpal tunnel and in spinal conditions for like irritated nerve roots. We can use the platelet-poor plasma. We utilize this a lot for muscle injuries throughout the body and in the spine. It's been used for atrophy and issues for your deep back stabilizers called a multifidus, and it can be helpful at improving that tissue. And then, of course, the thing that most people hear about are stem cell-based therapies, a very specific stem cell called mesenchymal stem cells. These can be isolated from your bone marrow and concentrated. If you assess mesenchymal stem cell function in the lab to assess what they can assist with or turn into, you can see that they can turn into cartilage-like cells, bone, nerve, muscle-type tissue. And so these are all orthopedic-type tissues. Stem cells work in multiple ways. In general, they act as kind of a signaler for healing, but they can also respond to the environment. They can transfer information out to the injured tissue to help give it the necessary things needed, proteins, growth factors, genetic material, improved mitochondrial function, those kind of things. And they can also transform into these different tissues. And so we tend to utilize these for advanced degenerative processes, more severe arthritic change, bigger injuries to soft tissue. So just a summary of that, the different things that we provide, we do a lot of injection-based treatment. We utilize a solution called PRP. This is the platelets that come from your own blood, and these are the things that's useful for. We can utilize platelet lysate around irritated nerves. We can use the platelet-poor plasma for muscle treatment, and we can use bone marrow concentrate, which contains those mesenchymal stem cells for more severe degenerative processes. Now, what's out there as far as data? So there's a study done looking at the use of platelet lysate versus steroid injections for irritated nerves, radicular symptoms, showing significant improvements with platelets over steroids for functional improvements at 3 and 6 months. We do have a phase 2 trial utilizing stem cell technology where we can culture and expand people's bone marrow derived cells and use that for disc degeneration. Hopefully in the next few years, we'll actually have an FDA approval for that to be able to allow more access to that type of technology in the United States to give people more options for disc degeneration. This will be specifically for low back pain. Other studies out there, Dr. Patin actually has a 5-year follow-up study looking at treating low back disc degeneration with bone marrow-derived bone marrow concentrate, which contain those mesenchymal stem cells. 5-year follow-up, 81% of them avoided surgery, and the average reduction of pain was 71%, with significant improvement in disability. There's other PRP studies out there showing significant improvements over the first year. There's also a few studies by Dr. Lutz, which I don't have here, for disc issues and discogenic pain in the low back, treated with PRP with 3-year follow-up, with outcomes in the 70 to 80% of patients getting significant improvement stability over 3 years. We also have, for cervical spine, looking at PRP and prolotherapy for cervical spine pain, treating the full functional spinal unit with 2-year follow-up, again, showing significant improvement in pain and dysfunction. This is on our website. We have a huge list of studies that we performed. We have other ones that we performed, treatment of lumbar degenerative disc with stem cells with a 6-year follow-up, showing 87% of people responding with MRI changes. Our Colorado clinic does a lot of upper cervical spine instability from trauma or connective tissue disorders with stem cell treatment, which can be helpful. We published some data on using the platelet lysate for epidural injections and radicular symptoms, and other studies for injecting the disc with those mesenchymal stem cells for low back pain. So as I mentioned, we do have a registry that would track outcomes. We're almost at 20,000 patients for our spinal registry, tracking people's pain over time, function, pain, and improvement. So this is important. This is how we learn if our processes are helping, what complications or risks are we seeing, what patients should we not recommend treatments for. So it's very helpful in patient education. Now, how do we even start to decide if what we do is an option? And that's really starts with an evaluation. All of our evaluations are at least 1 hour long. This gives us time to assess the patient, the problem, the imaging, perform a physical exam, review medical history, prior treatments, and then that allows us time to discuss all options. We tend to go through all options, including all of the more traditional things, and sometimes we'll send people off for surgery or just physical therapy. But understanding the problem, the structural issue, helps us develop a candidacy rating based, again, off our registry data and our published research. So are you a high responder, a moderate, or a low responder? This will be determined by what we see on exam and with imaging. And then from there, we will have the discussion about what are the options, what do we see as far as success rates, what are the limitations, what are the potential risks and complications. And then from there, we can customize a treatment plan if it makes sense for your condition. So for example, if someone has what sounds like a radiculopathy, so an irritated nerve, and then the MRI findings show very mild changes, then we might only be injecting that platelet lysate at that area of herniation. Most people will need 1 to 2 treatments. The majority of people 1, some people 2, to get long-term improvement. That's one approach for a very simple problem. How does that work? So the procedure day is a 1-day procedure where we have to draw blood. Our manual flexible processing lab is where we can isolate the cells. Now we have the ability to concentrate to different levels because we can adjust based on the severity, the age of the person, the tissue that we're treating. And that usually takes about an hour to hour and a half for the processing. And then we can perform an image-guided injection around the nerve root, confirming its placement, and then injecting that solution based on what the problem is and what the MRI shows. Now, if we had someone with a little bit more issues, they have some nerve issues, they have tightness, their MRI shows a little bit more significant degenerative changes, they have some evidence of instability and some arthritis, these people can still be PRP candidates. They might need 1 to 2 treatments. And we're going to utilize 3 different products to treat all of these different structural abnormalities. We're going to use PRP for the joints and ligaments. We're going to use the platelet lysate for the nerve irritation. And we're going to use the platelet-poor plasma for some of the muscle issues. A similar procedure day with the blood draw, the processing, and the injection. But the injections will be more complex. So we're going to treat the nerve, we're going to treat the joints, we're going to treat the ligaments, and then we're also going to treat the muscles. So that's a needle with ultrasound guidance, injecting those multifidus muscles. And that's how we kind of treat the functional unit of the spine. Now, if someone had more significant issues, where now they have a big tear in the disc, and that's generating lots of pain, we might now start be leaning more towards the stem cell bone marrow concentrate procedure, where we're going to utilize that combination for the disc. We're going to use that for the joints. We still might use some PRP for the ligaments and the platelet-poor plasma for the muscles, and now the platelet lysate for the nerve irritation. So now we have 1, 2, 3, 4 different products that we're able to get because we have a flexible lab platform, so we can do all this in one setting. The day is a little more involved because we have to extract the stem cells from the bone marrow. It takes about 30 to 40 minutes. We can use some IV sedation. We still will take a little bit of blood. We will do the processing, which takes a little bit longer, about 3 hours. And then we will do the injection on the same day. Now, we do extract from your own bone marrow, mainly because of compliance and because of the data. Most people, 90% of people, it's very comfortable. We do have twilight sedation available, so people are comfortable. It's a 30-minute process and very feasible for everybody. Now we're going to treat everything. We're going to extract the bone marrow. We're going to inject around the nerves, the joints, the ligaments, and the muscles like we did before. But now we're also going to treat the disc because of the tear and some of the degenerative processes. So that's the approach, the most comprehensive approach to treat all components of the spine. Now, what do we expect post-procedure? There's going to be a few days of some soreness and stiffness. Most people, we will recommend some type of physical therapy, again, based on what we see functionally with the physical exam. If people get a disc injected, sometimes we recommend bracing. We will give people a short-term amount of pain medications to get through those days of some increased discomfort. People will be asked to modify their activity for a couple weeks. Disc injections can be painful a little bit longer. And our follow-up process on average is we follow up at 6 weeks, 3 months, 6 months, and 12 months, more if needed, depending on people's symptoms. It's always important to remember that everybody's unique, and even with the same structural problem, some people respond differently. So some people may need more than one treatment over time. And our approach is to treat, reevaluate, treat, reevaluate. So we don't typically set up a series of injections. We're typically treating and reevaluating to ensure we're seeing the appropriate response. And if not, then we need to make adjustments or make different recommendations. So just an example of some different images, a huge disc herniation treated with PRP, 6 months apart, showing some good structural changes, disc tears in the low back at L4 and 5, showing resolution on post imaging, large central disc herniation at L4-5 with significant reduction in that herniation post treatment with PRP. So those are just a few examples of some structural changes. We do want to move into the question and answer section to see if people do have any specific questions they want me to go through. If you can write, there should be a little button that says chat or one that says question and answer. If people would want to write down some questions, then I can go through that. In the meantime, I will put this up on the screen. This is contact information to our patient education and scheduling team. So Danielle, you can give her an email or a call and she can get you more information, help get you scheduled. If you have questions, she can answer it. If you have imaging you want us to assess, then she can help facilitate getting that to our clinic. Our clinic is located in Henderson, Nevada, off the 215. We're basically open Monday through Friday. So that is a good way to contact us. Questions that typically people ask, obviously people want to ask about outcomes, and the whole success rates are dependent on the structural findings, how much disc is left, how much is collapsed, how much space there is around to get needles in place, how large the herniation is, how much arthritis do you have big bone spurs poking on a nerve, or is it a small disc bulge? Do you have significant enlargement of your ligament, creating pressure on the nerve sac? All these things are going to affect outcome. In general, for more common issues, mild to moderate, outcomes are in the mid 80 percentile of patients getting better. We do see maybe a 20 to 30% repeat injection rate over a couple year timeline of follow-up. But again, that's just going to depend on your specific structural findings. The risks are all related to the needle insertions. We have a 10-year follow-up study on 2,300 patients looking at utilizing bone marrow-derived stem cells for different orthopedic conditions, including the spine. The overall serious adverse event rate was 0.17. Comparing that to a lumbar surgical fusion rate of 30 to 40%, significantly lower. Most complications were pain, inflammation, swelling. Now, anytime you're injecting the disc of the spine, there's always some level of risk for a disc-related infection. We do everything we can to minimize that. The rates for that can be 1 in 1,000 or less. Kind of depends, on so many different factors. So always discussions that we have, again, weighing risks and benefits. What's the success potential versus what are you exposing yourself to? Obviously, compared to different surgical interventions, it's way, 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 way less. But it's more risky than just doing physical therapy, of course. So things to consider in that sense. Sometimes we'll treat people's neck and low back at the same time. This kind of depends on what's going on with patients. Most of these procedures are not covered through your traditional insurance. Regenexx is the only organization with coverage through corporate self-funded employers. We have almost 2,500 companies that cover our procedures for their employees as a benefit. We're using that as a way to show cost savings, surgical reduction rates, low complication rates, and good improvement. Quicker return to work, those kind of things. So that's unique in our network. But outside people that have that, it's more self-pay. Procedures can range anywhere from prolotherapy being a couple $100 to PRP close to $1,500, and it can go up to $6,000 or $7,000 if you're treating multiple levels, utilizing bone marrow, multiple discs, sedation, all of those things. So there can be a huge range. So there's not one kind of cost for everybody. It just depends on what needs to be done. So any other questions that people may have? So it doesn't look like a lot of other questions written down. It's already been about 45 minutes or close to. So I just wanted to say thank you. I appreciate your time this evening. Please reach out if you have more questions. If you're confused on anything we said, or you just want to get a consultation to learn more about your specific situation, then please reach out. Danielle is a good contact, and hope to hear from you. And if nothing else, hopefully you learned something and that you understand there are more options out there. Again, it's not the right option for everybody, but there's more tools in the tool belt that sometimes people aren't aware of. And so that's why we like to have these webinars. All right. Well, it doesn't look like there's any other questions. Reach out if you need us, and I'll let you guys get back to your evening. Thank you again.